Is called to order. Madam Clerk.
In accordance with the Open Public Meeting Act of the State of New Jersey, adequate notice of this annual meeting of the Franklin Township Board of Health was made as required, indicating that this annual meeting would take place at the Municipal Building at 6 p.m. on Tuesday, June 25th, 2024.
If we could all stand for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America, republic for which it's okay. It's all yours.
No, roll call. Hold on.
Oh, for those watching, I have no script here, so I'm winging it.
You're right, Mayor. You don't have clerk.
So, Madam Clerk, call the roll, please.
Councilman Embarrasson?
Here.
Councilwoman Francois? Councilman Karazi?
Here.
Mayor Kramer?
Here.
Councilman Onijaka? Deputy Mayor Potasnik? Councilwoman Udine?
Here.
Councilman Vasanella?
Here.
Councilman Wright?
Thank you.
Okay. Good evening, everyone. Mayor and Council, thank you for allowing us to be here.
Got to get right into that.
Got to get right into it. Okay. All right, I'll try to be loud in case this doesn't pick me up. So, again, thank you for being here. My name is Mike McCarty. I'm the Deputy Director for the Somerset County Department of Health. I'm just going to give, and some of you may remember me from last year, I'm going to give a brief overview of the department, what Somerset County Department of Health was up to over the last year in 2023, and specifically what we were doing for Franklin Township. So these are our 8 main program areas, and by the way, I don't like narrating off of PowerPoint slides, so if you have any questions at any point, please feel free to raise your hand, stop me if you have any questions or want clarification. These are our 8 main program areas. Really, it should be 9, but consumer health, that's your health health inspectors doing your pools, restaurants, retail foods, all that good stuff. Health education and promotion, chronic disease and cancer prevention, those are linked together. We have the County Environmental Health Act under our department. That's the DEP representatives. They're doing your air, noise, water pollution, things like that. We have our epidemiology and our nursing division. We have our FEP team that is, deals with emergency preparedness, our Medical Reserve Corps, and our Childhood Lead Poisoning and Prevention team. There really should be a 9th for administration, but I digress. This is our team. This is basically the same list of people that was at the department last year. We do have a couple changes, a couple promotions. Unfortunately, Patty Elliott, who many of you probably know, she did about 40 years in public health, retired in December. Fortunately for us, I do have Rashida Boyna behind me. She took over for Patty. Rashida's been with us since January now. And Rashida and I started together about 10 years ago, so we were very happy that we were able to convince her to come back. Other than that, Dr. Terry Clancy is the health officer for the department. I'm the deputy director for the department, and this is kind of the structure for the rest of the department. Whoops. So again, I don't want to bore anyone with raw data and details, but this is basically what Rashida's group has been doing since 2023. These are the numbers. You can feel free to read these, and if you have any questions. Otherwise, I'll just narrate basically what we're doing. Retail food pre-operational inspections before an establishment is approved to open. That comes through our office. After it goes through your zoning office and your processes. Temporary retail foods, so we're doing your events, going out to the Franklin Days and things like that. Mobile foods, Franklin, we also do the reoccupancy inspections for all the apartments upon turnover of tenants. We do septic system installations and investigations in town, child daycares, rec bathing facilities, and well abandonments. So these are the breakdown of the complaints that we received for Franklin Township exclusively last year. 41 retail food complaints, 67 garbage and debris, and so on. So, yep, Rashida's group and previously Patty's group has been very busy with these. So this is the health education section. So Stacy Toolin is the program coordinator for the health education program. So basically these are people that are tasked with making health education materials, our press releases, doing community outreach, things like that. And so I'll talk a little bit more about that because we've been doing a lot of novel things that we haven't really been able to do in the past before. So like I said, this is a group that does the creation of health ed materials, press releases. We do community outreach, food handlers training. So before anyone can serve food in your restaurants, they either have to be Serve Safe certified or a Learn to Serve certified. They have to have some level of certification that proves that they know what they're doing before they're handling food product. We partnered with Healthier Somerset. That is as part of the Community Health Improvement Plan process and the Community Health Needs Assessment process. I'll talk a little bit more about our own internal process that we're running in a little bit. As part of the health education and program team, we also have the chronic disease self-management program. That individual is Katie Stewart. She's tasked with effectively just dealing with chronic disease, mostly cancer, breast cancer, things like that. They also do our website management and our social media creation. So in 2023, these were a couple of the things that we were able to do through our health education team. And this is stuff that we were really excited about because the phrase that comes to mind is never let a good crisis go to waste. Everything that's on this list is paid for by grant funding, which we previously have not had. So we were excited. We were able to do a TV advertisement last year. We were able to advertise in the mall and just doing general health ed topics like, washing your hands, staying home when you're sick, things like that. We also had a couple geo-mapping campaigns, and this is something that's really cool. It's also a little bit expensive, but again, we use grant funding for this. The geo-mapping campaign, if we had, for instance, we had a little mini outbreak, we'll call it, of monkeypox. So what we did is we worked with the company that we had previously worked with, and we said, this is how many clicks we want. We want to target this area and this population of people, and they'll set it up so that they get an ad on their phone, and they say, hey, if this is something that interests you, please talk to your primary care physician and consider being vaccinated. And we also had the billboard on Route 287, which is something we've had in the past before, but it's something that we can continue doing as long as we have the grant funding to do it. I previously mentioned our RCDC, the Regional Chronic Disease Coalition. We are partnered, I don't know how this ever happened, but we are partnered with Morris County as it stands presently. And basically what that is we have to run programming. So you'll see here in this little corner, we have Cancer Thriving and Surviving. That's a program that we offer a couple times a year. I believe there was also a program that we ran. I have to check. I think it was Franklin. It was in September of last year. And I believe that was the Chronic Disease Self-Management Program, which was at the Senior Center. And I believe we're going to be doing that again this year, just because we got a full turnout with that last year. I had mentioned previously that we also have the CHA department. That's our county environmental health folks. They work hand in hand with the New Jersey Department of Environmental Protection. Every county health department has them, situated within the health department. So this is a breakdown of the activities for Franklin Township last year. 158 total actions, I'll call them. A lot of those are Public Record Act requests. But you'll see that there's some solid waste complaints, complaints referred from NJDEP, air emissions, and safe drinking water. So what Erin and her group have been doing pretty well, actually, is we've been incorporating GIS into a lot of the functions that they're doing on their side, so you can get an actual visual representation of where issues in your town are happening. Somerset County on the whole is expanding GIS services to do a lot of cool things. They gave us a presentation last week, so if I want to see cancer screening rates in Franklin and I want to break it down by ward, they've promised me that they'll be able to do that. And things like that. If I wanted to see non-English speaking within a municipality, they can do things like that. So we are expanding that at the county level as well. Our epidemiology, nursing, and disease prevention program, this is the ultimate goal of the program, is to reduce the spread of communicable diseases in the community through timely investigations and contact tracing in Somerset County. So this is a very wordy slide. I didn't put this one together, so don't blame me. But basically what this goes through is a little bit of the program highlights that the nursing division has to maintain and do every year. One of the big ones is the child immunization audits. So you'll see on the third bullet point down, our nurses have to go out to every school, daycare, under the sanitary code, and we have to check the students' immunization status to make sure that they don't have to be excluded from the classroom. This is just a breakdown of the communicable diseases that were reported in Franklin Township. You'll see the blue bars.
Could you, excuse me?
Yep.
This is a compliment. Could you go a little slower?
Oh, absolutely. Yeah, absolutely. So you'll see that.
We just, by the way, we just, I guess those who got opened their email might have seen it today, but I don't think any of us ever saw this report, so.
Absolutely.
For me, it's important. I want to.
Sure, sure. If you have any questions, like I said, please feel free to stop me. I do not mind whatsoever.
I missed it, but I'm just jotting questions. We'll wait until
Sure.
if you can go a little slower.
Yep,
Thank
sure.
you.
So you'll see this, this blue bar here is by and large still the majority of communicable diseases that were in Franklin Township last year were still COVID. In our Board of Health reports that we provide to the board, you as the Board of Health and the Advisory Board, gives a breakdown of the other top 3 or so is what we kind of found as the sweet spot, or at least that's what we think is the sweet spot of other prevalent diseases that we had per month in the municipality. Again, this is just another breakdown showing the top 5 communicable diseases that we identified in Franklin last year in 2023. Overwhelmingly, like I mentioned, COVID-19, Lyme disease second, hepatitis C was third, hepatitis B fourth, and babesiosis was last. Another part of our nursing team, a little bit off on their own in a little bit of an island, but still part of the nursing group is our childhood-led team. We have one dedicated full-time nurse case manager who does all of our follow-up for any environmentally or elevated blood level child that we identify. So you'll see we put this blue bar, this blue box around Franklin Township just to give you an overall representation. So while it does look to be the second largest municipality that we have that has that level of elevated blood level children, I think given the population, because these are just raw totals, given the population in Franklin Township, that's actually pretty good. You'll see North Plainfield Borough is by far our worst offender at this, is just because of the housing stock in North Plainfield. A lot of the housing stock in Franklin Township, the apartment complexes are either built post-1978 or they have lead-safe or lead-free certifications. So usually if there is an issue in Franklin Township, it's usually we found cultural, food, cosmetics, things of that nature.
Excuse me, we're the second largest?
Yeah, as you can see here, so this is
No, on the bar graph,
On the bar
Mayor,
graph.
not
Oh,
the
okay.
township.
Yep.
Okay.
On the bar graph.
On the bar graph, yeah. Yeah, the raw totals are actually very low for Franklin Township. I think last year was about 20 cases that were confirmed elevated blood level children. So given your population, that's actually probably really good.
By population, we are the equivalent to all of the other towns combined.
Right. Okay.
So I had mentioned a little bit before that this is just basically a little overview of the other side of our nursing units. So they will conduct the immunization and the well visits and the exams for children. So this is a breakdown of them. You'll see that the flu shots administered was provided by our department. Some of these statistics are because, for instance, the HIV testing, we actually contract that out with Zufall as our FQHC in the county. What I will mention in a little bit, just towards the end of the presentation, is how we're trying to bridge that gap. We've had some, we'll call it community feedback, stating that we haven't really been. There's definitely a gap between services between what Somerset County Department of Health can offer and what Zufall as the FQHC can offer. Another breakdown, more numbers on the chart here. We also contract with a company called ID Care. They are the ones that maintain our tuberculosis clinic. That clinic is situated within Robert Wood Johnson Medical Center. So these are the raw totals for TB cases in Somerset County last year. This is a little bit about our FEP team, as I call it, the Public Health Emergency Preparedness and Response Team. Their ultimate goal here is to provide public health emergency preparedness response plans updates messages on a countywide basis daily. So if any of you are subscribed to our Links messaging system, you should be getting these alerts. They come out daily, if not, sometimes several times a day, with things like cosmetic recalls, foodborne illnesses. It's just generally good information to have. So if you're not subscribed to that and you would like to subscribe to that, please let me know, and I'd be happy to put your email on the list. We do have our links coordinator in the department maintains that list.
Sir?
Yep.
Quick question before I forget. Do you have various settings? I notice on there if someone signs up, they're going to maybe get hundreds of messages. Do you have to where they can get a certain type of messages like they do with alerts on cell phones?
Yes. There is a way. There's a way that we can do that internally, that we can break
that's
down your
available to a person that may want to sign up for certain type of...
Yes, you can break it down so you're not getting every, you're getting class 1 recalls, which means that the health department has to go out. You're not getting...
So that's available for the sign-in process for the public. They'll be given options?
It's a little bit convoluted, the process now. You still have
You don't have to get deep into it now.
Yes.
I just wanted to, okay.
There is, though.
If there's time permitting, you can elaborate or get back to me another time. Thank you.
So a little bit more about our emergency response for 2013, or 2023. Wow, I'm going way too far back now. This is the amount of COVID vaccinations we administered, how many test kits we administered, our homebound vaccinations, how many we did last year. We did some exercises with our FEP team and our Medical Reserve Corps team, as well as some other response plan updates. So Somerset County Medical Reserve Corps, we're really trying to rebuild this. We're fortunate enough we just hired a new Medical Reserve Corps for the county, and he's basically dedicated to doing just Medical Reserve Corps and the links coordination for the Somerset County. So we're excited to have him on board and really try to make this a more robust unit. Basically, we have a network of medical professionals, and it doesn't even have to necessarily be medical professionals. We have some administrative people that are in the Corps as well. So we're always looking for new volunteers, and we are trying to do a little bit more programming with them. We did a Stop the Bleed kit, or a Stop the Bleed training with them last year. We did an Autism Shield training with MRC last year. So we're always looking for ways to keep our members engaged. A little bit more about the childhood lead prevention poisoning. I'd mentioned already the raw totals before, but this is the goal. I'm not going to read the whole thing to you, but basically, the whole goal of the CLEP project, as we call it, is to reduce and eliminate the risk of children becoming lead burdened and poisoned. We follow children up to 72 months, but the code is a little bit weird in that if we have someone that is consistent and persistent, we can follow them actually up until they're age 17. So sometimes these cases can last a very, very long time. I believe this is Franklin specific. So when there's an elevated blood level child, there's a two-part thing. There's the environmental. That's where we will go out with trained inspectors. They will use an XRF, X-ray fluorescence. They will check walls, floors, windowsills to make sure it's not something that's a hazard in the house. We also have our nurse case manager who will go out and provide a lot of education, nutrition, and just general health ed topics on how they can manage the lead level for the child. So we've actually made this program a little bit more robust. We've been trying to, as it mentions in the bottom, we've been distributing water filters and just cleaning kits for people. We've had a lot of people mention to us that they've been very appreciative of getting these kits because they don't necessarily have these expensive water filters or these mops and kits that they can use for cleaning supplies. So we've definitely had some success on that front. This is an overall screenings. So these totals look a little bit gaudy in my opinion, but these are all screenings done by pediatricians, doctors' offices, hospitals, us. So Franklin Township, about as many as last year, had about 748 children that were reported that were screened for lead in 2023. So that is basically the end of the presentation. So I just want to give an update. I know this isn't 2023, but just a quick update on where we are and where we're going as a department. We have a meeting and we have a site visit next week to go over our new Vaccines for Children clinic space. That's something that we've wanted for a long time, but basically what we've heard is that there's a lag time, a wait time for Sioux Falls to get a lot of these uninsured and underinsured children vaccinated so that they can go back to school. Because if they don't have their vaccination series and they don't have a religious exemption, we are forced by law to make sure that those children are excluded from the classrooms. So we have a space. It is at Richard Hall. What we're planning on doing is gauging the demand for that in the early going and seeing if we need to make that a one a day, once a week type thing, a twice a week type thing. We're excited about that because Somerset County Transportation will run to that clinic space. So people that don't have transportation in Bound Brook or Franklin can still get to this clinic space, get their children vaccinated. We'll do screenings there, we'll do well visits there, so we're looking to make that a little bit more robust. So by the end of summer, we're hoping to have our temporary space set up there. We're also going to be procuring through grant funding an electronic health record, an electronic medical record system, so that we'll be able to do appointments and track all that, track all those children. I've mentioned this ad nauseum probably over the last couple of years. We're working through our public health accreditation process. That process is probably about midway through. We are applying in October of this year. Basically what that does is that just has us we're measured against a national standard. There's only one other county in New Jersey that I know of that has already received this accreditation. I believe that's Camden County. But we're looking to do that just so that we make sure that we're not missing any gaps and seeing where we can effectively deliver better services. Lastly, we are doing our health database is due for an overhaul. So we have our new vendor, Rashida, and her group have been great working through that process. So basically, that'll be just joining the 21st century. People will be able to log complaints in online. They'll be able to visit our online portal, and they'll be able to see real-time inspection reports if they want to go out and go to a restaurant and say, hey, I'm not going to eat here now because I've seen this inspection report. So those are our three or four big projects that we're working on right now. Other than that, I'd love to take any questions you guys might have.
Vassanello?
I'll give you a few of my top questions, and let others have a chance. Not to harp on it, but I don't know when this information is available from 23. Is there a way we can get a report, even if it's a draft report, more than pretty much at this meeting?
Absolutely. Yeah, and I apologize if that's not already happening, because we usually give all of our boards of health a year-end report that just summarizes all the stats. So if you haven't been getting that, that's on us, and I apologize for that, because all of our boards.
And also whatever you're presenting today, because some of these questions I probably could have found out on my own or emailed separately, and anyway.
Sure.
A couple of quick things. Food handling, I notice you do it virtual. For what it's worth, I don't think that's effective. I think food handling is still one of the biggest issues. Not saying we're any worse than anywhere else. I go in places and just politely kind of walk out because having some knowledge to see what's going on. Love our restaurants in town. But I still think that's a big issue nowadays, especially with the transiency of employees or the lack of training that I keep hearing from friends I know in the restaurant business. So I really think that should be focused and should be in person. I'm wondering if you do any kind of follow-up. I don't mean investigate, but is there any real field applications to approaches to going out and seeing if the people you just taught are doing it? Or, I mean, what do you do? Like if a place gets violations for that specifically, what is the follow-up? I know there's other things with food handling, food restaurants, but to me, that's one of the most critical. So if you could elaborate on that, and then let me just throw out something else to try to consolidate this. The other big thing I had concern, or two issues, the fines. Is there a way that the part that is public information, and I'm sorry I'm going so fast, but I know we have little time, can someone go and click on, and if they can't, can you see if that's something you could do for our town, that they can click on that map you had, assuming it's public information, and find out exactly what the violation was, what the resolution was, et cetera. I think it's important to our people who are interested in this, in that stuff, people who have asked me about it before. And then the other thing, the lead, as you probably know, there's new ordinances in the state, statutes that now towns are adopting. I hope we don't get a lot of lead, bad lead reports, but with the new law that rental properties have to go through a lead inspection process, do you have a way that you follow up if one of those comes back, because I don't think that's derived from the health department, if one of those comes back as positive, do you have a system set up to where then you can go and make your services available or track or whatever you do with lead to anybody who may have a concern? So if you can, sorry to throw it all at you, but if you could address those.
Let's back up to the your first question, which I wholeheartedly agree with regarding the ServSafe being in person. That's something that we did right up until COVID, and I'm not going to blame COVID because we do that all the time.
Yeah.
Yep, we're way past that. So what we did is, to bridge that gap at the time, we decided that we were still going to offer the program, but we were going to do it in a virtual setting through ServSafe, which is nationally accredited. It's a very good program. It's the most popular one. It's basically the, calling it tissue Kleenex is ServSafe. But we have been talking about reinstituting maybe twice a year in person, and that's basically, we were doing it quarterly, the food handlers training. So we're talking about doing that at least, twice a year, having those back in person, and because a lot of people do learn better that way. So that's something that we've been talking about, but only to the level of basic food handling. So if anyone needs a food handler or food manager training, they're still going to need to go through one of the national outlets for that. But to your second point to that question, I don't really think so. Rashida can correct me if I'm wrong here. When someone gets the certification through us, we don't usually go back out and check that. Now, we are doing our, our due diligence, and we're doing all of our retail food inspections. Basically, how those work is if you have, I call it 3 critical violations in an inspection, you're automatically ruled out of person in charge maintains knowledge. So that's one check that we have in place, but we don't go and revoke your training or anything like that once you receive it.
Retrain?
I don't think there's an avenue for retraining.
There's no avenue to retrain if
Yeah.
place is in violation of food handling issues?
Not that I'm aware of.
Not an issue,
Yeah.
you move on,
Yeah.
I'm amazed, but okay.
Yeah. Do you think there's anything? We can, you know what, I'm going to get back to you on that, just to make sure I'm not speaking out of...
So if there's not retraining, then they just have to take the entire course over again.
Yeah.
So that's the recourse, Jim. It's not that there's no retraining. They have to take the entire course again and pass it to be permitted to handle food.
Definitely if they failed it.
Right.
No, but I mean, if you go in and there's an issue, violation for that,
Yeah.
you retrain that person or the whole thing, or they're...
It's difficult because, that person might not even necessarily be on site that day.
Right. That's what I'm kind of
yeah.
getting at. It could be systemic to where it just needs a little reinforcement, but whatever, we can maybe communicate,
Sure.
or whatever the proper protocol. I just would love to see that, enhanced to be the best possible for our town, that's all.
Yep. You had mentioned and I think I missed one in between there.
And the environmental, resolve
Yes,
environmental
yes.
complaints readily available to the public.
That there's parts of it that will be readily available. What you're seeing there with the GIS will be readily available, but specifics about it, the actual address, the name of the property owner, that's still going to be public record, but that's still something that they're going to have to request through the OPRA, FOIA process. We only release certain bits of information.
But they'll be able to go and tap on the thing, the map, and see, so whatever Acme Corporation got a fine for polluting the water resolved
It'll
on
show
blah,
what
blah
type.
date.
Yep.
Okay.
You'll see at least that part.
Great.
As far as the lead part, so this
Yeah, all
gray
the new
bar-
lead
yep.
stuff, how that,
The gray bar here actually shows less than 5 micrograms per deciliter of blood, and the reason that we thought that we should show that on the chart is because the new law will be changing to dropping that to 3.5 micrograms per deciliter of blood. So we're expecting across the board, across all of our municipalities, to have higher raw totals of, unfortunately, of children that are, poisoned. What we did proactively last year is we identified all those children that are in those gray bars, and we sent out education materials to the family, family is the parent, the guardians, to let them know that, hey, technically your child's not a case right now and there's not a lot we can do for you. Here's some education materials for how you can try and bring that level down. New Jersey's completely backwards, in my opinion, in the way that we treat environmental inspections because we are not allowed to go out unless the child is poisoned on the environmental side.
Are you allowed to contact, real quick, I think this was the last item, that if, with all the new statutes, when things come back, if they come back with a too high lead volume, that's not coming out of health department, is there a mechanism that you guys communicate? Like you're automatically notified if the rental unit is above the levels, so you could reach out for?
Not automatically. This is still very much a learning process.
And it's brand new. Is that something you could look at, whether it's through our manager or the county administrator, to see if there's a way that that could just be like a setup as an automatic thing? I would think that the health department would want to at least provide information and know if there's rental units that are above the levels and failed their health
So,
test.
Councilman, I believe that the requirement of the testing company that will be providing the testing is if there's a unit that was built and required to be tested that was built prior to 1978, that they're required to report to the State Department of Health, not the County Department of Health, the State Department of Health.
And so that's absolutely correct in my understanding as well. So what's been happening is I've been seeing, and this is again anecdotal, is some of our construction departments, Franklin being one of them, North Plainfield being one of them, they've had their designees reaching out and just saying, hey, just so you know, we had an elevated dust wipe floor sample that came back elevated. So, you know, we can be on the lookout for that just to send them health education materials, even though they're not technically a case.
Thank you very much.
Sure.
Anyone else? Those of you just turning in, this is the Board of Health meeting. Township Council is the Board of Health. We have a meeting once a year. Okay, so I skipped over a few items because I didn't have an agenda in front of me. Now I do. Going back to item number 4, approval of the minutes. Board of Health annual meeting of June 13th, 2023. Do we have a motion on the minutes?
So moved.
Moved and seconded. Any comments or changes? Madam Clerk?
Councilman Harrison?
Yes.
Councilwoman Francois?
Abstain, I wasn't here.
Councilman Karazi?
Yes.
Mayor Kramer?
Yes.
Councilman Onijaka? Deputy Mayor Potasnik?
Yes.
Councilwoman Udine? Yes. Councilman Vasanella?
Yes.
So,
I wasn't here last year, so I can remove, you can remove that, yes.
Move that to an abstention?
Technically, according to Robert's rules, you can vote on minutes that you weren't there for. You're just accepting them. You're not
He's correct.
voting on their validity or accuracy.
Yeah, you're right. Technically, you can. We usually abstain, but
Yeah.
we got
The
that
vote
cleared up.
passed.
The vote.
who would have believed?
Because like, what if the whole body changes? Then you can never accept the minutes from one meeting to the next. That wouldn't make sense.
Who would have believed? Item number 5, Advisory Board of Health. Do you have a presentation?
Thank you, guys.
Thank you.
Can I have one question of Michael first before we move on to the
I
next
asked if
item?
anyone had anything.
I understand, but then you jumped before you gave me a chance to say anything into your agenda. So this
gonna have a
morning, links went out regarding cooling towers and Legionnaire's disease. And the question was posed to me, are we distributing that to potential, if you read the letter, it comes from the New Jersey Department of Health, and it says in that letter, dear business owner, you are receiving this letter because you may have this type of device that needs to have attention paid to it when it's hot, right? I'm obviously very much paraphrasing. So the question was posed to me, do we have a list of buildings that might fall into this category? And my one-word answer was no. When I further looked at the links notice, obviously this comes from the State Department of Health, and in that, it encourages local health departments to distribute that document to the facilities in their jurisdiction. So now my question is to you, and I think I already know the answer, does the Somerset County Department of Health have a database of those buildings that would fall into that category in the municipalities that they serve?
unfortunately, I'm leaning no. To
Your
this.
one-word answer is going to be no, yes, and I understand that. But I question whether or not there is something at the state level. I mean, because I went to the Department of Health website, not you, but the state, after I got this email, and looked into what it is that they have about Legionnaire's disease and notices and things to do, and it talks about schools and hotels and all of the things that might have that type of HVAC system that's susceptible to that. I don't know how we would begin to prepare a database. We have a whole lot of buildings in this town that fall into that category.
So I'm wondering if our fire inspectors, would that be appropriate?
Well, I know, because the fire inspectors just simply, I mean, I can provide for you a database of buildings, but I think that it would just be that. It would be the entire list of buildings, commercial buildings, schools and all that. I mean, they do fire inspections, right? I mean, I don't know, a cooling tower could be present at a warehouse, right? I don't know. I'm not knowledgeable enough on HVAC systems to understand that. And you're asking me those questions because you're the one that sent me the email. But I bring that up because these are the types of things that I don't know how to, I mean, I think what needs to happen is, this obviously went out and it's distributed by you.
Right.
This came out of Somerset County. So I think that for things like this, the county health department needs to look at the municipalities that it serves and ask the question that the mayor just asked me this morning. Do you have a list of this, or can you put together a list for whatever? This is one example. There might be 100 other examples.
Right.
I don't know what, when it comes to things like communicable diseases like Legionnaire's, right? That's, so I just bring that up because, I mean, it's sort of like a rhetorical question, but nonetheless, a
great
question
point.
that got asked to me, and I figured it was kind of timely.
So I'm going to do some digging on that tomorrow because, I wholeheartedly agree, and I think that's a great point. So while I don't have an answer for you tonight, maybe I have something more concrete tomorrow. Hopefully, fingers crossed.
You know how to find me.
Appreciate it.
And if we did have any questions for follow-up, because I know we got, obviously, our council meeting coming up, what is the proper protocol? Manager may know better than you, so whoever, that if we have a question, do we just email, or should we email our manager, or email you, or?
Come directly to me, that's fine. Whatever way, whatever.
Bob, is that?
Whatever way you.
Like, if I wanted to follow up on a couple of things I mentioned.
As you
proper?
know, Councilman, what you are getting around to is the employee council relationship.
what would you like
They're
us to
not
do?
our employees. They're our contract, and you have every right to reach out to Mike or his boss or anyone else at the health department and ask questions. I mean, there's no reason why you can't do that.
Okay.
I think that for continuity, and I would ask that you include me if it's an email.
Which
so
I
at
usually
least I
try.
know that you've asked a question, so that when you say to me, a month later, hey, I emailed the health department and they never answered me, at least I'll know that you emailed the health
I got
department,
you.
and I would.
I don't think that's going to happen, but I understand exactly what you're saying.
I don't either, but.
Okay,
Okay, we're going to move on.
I'm good, thank you. Thank you, Mayor. Some good stuff, and thank you, it's a lot of good info.
Are you good, Donna, with that? Try. Mike, you want to jump in on your computer? We're reading your emails.
Oh, that's okay. I got nothing to hide.
Could Oprah them anyway.
There you go. If my computer blows up. Oh, yeah.
Dun, dun, dun.
Thank you. Thank you, council, for giving me the opportunity to present.
Got to go into the mic.
Pull it down.
Sorry.
There
Okay.
you go.
Thank you, council, for giving me the opportunity to present. I'm Dr. Donna Lisi. I'm chair of the Board of Health Advisory Council. I want to thank the council. I want to thank Mike and Rashida, and I also want to give a special thank you to Councilman Karazi. He's been a great support since I took over this role in January of this year. So what I want to do in a little bit of time remaining is I want to share some of the things that we've been doing and some of the things that we're looking forward and some of the things that I feel we could be doing even more and addressing some of the concerns of the community. Okay, so this is our mission statement. I won't read through this. This is the mission statement of the Board of Health Advisory Council. And these are our goals, and so some of the things that we talk about today are to help meet some of the goals. I do have to say that one of the goals is me to change that first one, and I have to find out the protocol since I'm new to this, the Franklin Township Health Department. So since we don't have one, I don't know if that has to go through some kind of protocol to get that wording changed. So these are our members as of 1/3/24. I'm chair, and we have a number of very qualified people in our committee. We have nurses, we have EMTs, we have mental health professionals, we have neuroscientists, and we also have a JD candidate. So one of the goals that has been my focus since I've took over this is education. I think as a Board of Health Advisory Council, we should be very educated in terms of the resources and the problems that are out there. So my first effort was to bring in the Department of Human Services and to learn about the mental health services that are provided at the county. I should also say that I am chair of Somerset County Local Advisory Council on Alcohol and Drug Abuse. I'm past vice president of the Office on Aging Advisory Council, and I'm on the Municipal Alliance of Franklin Township, as well as a member of the Somerset 100 and Safe Coalition. I'm one of their stakeholders. So pulling upon my background and all the resources that I have access to, I'm trying to educate our group so that we know how to direct people if the event that services and issues come up, and how to direct people. So the second, that was in February. In March, I had Safi and Tara come and speak to us on the local needs assessment and action plan. And so a lot of the actions that have been taken since then have tried to address some of the needs that have been identified. In April, I had the police department the police department actually had their Arrive Together team come. We had Officer Reyes and we had Nicole Crowley come and speak to us about the Arrive Together program, which is an outstanding program that is being copied in other municipalities as well. They're trying to reproduce that. And then May, I had Dr. Ken Finn, who is a physician, board certified in pain management and rehabilitation medicine, speak to our group about the Colorado experience when it came to cannabis legalization. So he talked about the impact that it's had on his community. He's a co-founder of the International ISAC, the International Association for the Science and Impact of Cannabis. And so I'm also an affiliate member of that group as well. And then on June 5th, we had an open discussion since we've been having guest speakers come in, and one of the things that we focused on is looking at the needs of our community regarding the mental health crisis, the Middle East crisis, and the mental health impact it's having on our community. So those are some of the things to just give you a background of some of what we've been doing on a monthly basis. In terms of some of our accomplishments, and this I have to credit Councilman Karazi for, is that we had naloxone added to all the AED boxes in the township, which was something that was modeled after what the county had done. Also, too, I attended a program, the Mental Health Matters, which was a program from Rutgers that was held at the Youth Center on January 7th, in which I promoted the work of the Board of Health Advisory Council and making them know that there was a group that they could bring their concerns to. I also participated in St. Matthias Self-Care Fair, where I was able to get naloxone from the county. So when the harm reduction organization out of New Brunswick had run out of nasal naloxone, I was able to provide them with kits. And then another important thing is, I mentioned I'm a stakeholder for the Somerset Safe Coalitions, and so I partnered with them, and with the help of Dr. Karazi and a number of other people in Parks and Recreation, we were able to bring a bench to Franklin, which sat outside the senior center for about 2 months, which focused on looking at alternatives to opioids. And so this is the bench. And what's important about this bench is that this bench was actually built by one of the members of that organization, and it's designed so you can't sit on it. It's not comfortable. There's a QR code on it that when you scan that, that will go to give you options for alternatives to opioids. This was actually streamed live. P.G. Parker from the Franklin Reporter was there and did a whole segment on that, about the bench and the opportunities. And so that QR code leads you to this page, looking at alternatives to opioids and other things, including non-pharmacological interventions that could be used to manage pain. In conjunction with that, I conducted an opiate education workshop on April 30th at the Township Senior Center, looking at talking about pain management, opiate use, as well as giving out naloxone to the members who attended that workshop. Other things, like I mentioned, Safi and Tara had come to speak to us regarding the local health needs assessment, and I had asked them prior to coming to identify some key issues that they thought would be something that our group could take up. So these were the 4 things that they identified. Mental health services need to be prioritized. There's a lack of knowledge and or understanding related to services available to those with disabilities. Specialized emotional and social services are needed for senior citizens, and residents would benefit from free or low-cost preventive screening and medical intention. Regarding the first couple, like I mentioned, I'm chair of LACADA, which is the Somerset Local Advisory Council on Alcohol and Drug Abuse. So I work very closely with the Office of Substance Abuse and Addiction and the counselor, actually the coordinator for the county, which is Lisa Federico. She actually spoke to our group back in February. So the county has launched an excellent program used initially out of opiate settlement monies, which was a behavioral navigator program. So this is now, they have a person that's dedicated to helping citizens of the county identify resources for mental health. So if someone would call her, she would be able, based on your insurance, based on the type of need, based on the type of patient, to give them a list of resources and places that they can go to for help. That website is now live as of just within the last couple of weeks, where someone can go to that website, check off a bunch of boxes, and get a list of providers. There's over 100 providers that are listed there. They've been vetted, and so that is an ongoing process as they become aware of more councils and other people who provide mental health services, and they get vetted, they'll add them to the list as well. I have also brought our needs to the local advisory council as well as to the Office on Aging and Disability. And so trying to share resources like the Office on Aging, Somerset County Office on Aging and Disability had a disabilities fair where they had a number of vendors and other resources available to educate the public about the types of services available. So those are some of the things that we're working on. I also frozen. Okay.
You want to just go?
It's
didn't
not,
work?
no, that's what
Because it's,
what I was doing. Maybe I stayed on one slide too long. Okay.
So while you're doing that,
Okay, sorry. Okay, so this is another thing. So just recently, the state changed the requirements for prescription medications for seniors, and so and for the indigent. And so I updated. I created this handout that looks at the different programs, the PAD and the senior goal, and Councilman Karazi was nice enough to photocopy these for me, and he distributed them to the Franklin Senior Center, and I gave these out at the Office on Aging to help beyond our group. Other things, our group participated in the Franklin Township Needs Assessment. I personally was part of the focus group. I also participated in the Somerset County Department of Health survey. And on Thursday, I believe myself and another member will be participating in this focus group that the Department of Health is having. And the point of all these is to help assure that that the diverse population health needs of our community are being addressed. Also, too, on May 22nd, I attended the Rutgers Cooperative Extension Network event. This was the first time they had such an event. It was held at the 4-H Center. And so one of the programs that Mike had mentioned, Katie Stewart is the public health educator coordinator for the chronic disease management. She was talking about, when she was presenting there about the cancer program that they have for cancer survivorship, I hooked up Mary Ann Regan from our township with Katie, and now that program is going to be brought to Franklin Township. Other things, on June 15th, the Power Somerset donated 48 kits, naloxone kits, that were distributed to the coordinators of the Franklin Juneteenth celebration. In those kits were a box of naloxone as well as a skin wound care kit, because in case substance drugs of abuse are contaminated with xylazine. I also had a rebreather mask in case someone has to offer CPR, as well as a resource guide and gloves. Okay. And then, so ongoing, just so the council knows too, Communities in Crisis is a peer recovery specialist organization that does harm reduction. They're based out in Burnsville, but every third Thursday of the month, they come to Franklin. They've been coming to the First Baptist Church, and they bring with them naloxone, fentanyl test strips, xylazine test strips, and anything that could be have to do with harm reduction, as well as they give presentations on different areas that could help people with life skills. So that's one thing that I want to encourage, getting the word about that. Also, I will continue to partner, and so will our members continue to partner with any organization that we feel can benefit the residents of Franklin. Also, with the opiate settlement monies, I know those are off with the police department, and I've been in touch with Officer Merriweather about that, and insist any way that is necessary or that would be desired to help identify issues or areas that those could be spent. One of the things that I do as part of my role in LACADA, we actually have a subcommittee that looks at hotspots and looks at where we have overdoses, and there have been a number of overdoses. This year so far has actually been a regression. We're actually seeing more overdoses, and so there's been a number of hotspot areas, like we're on the border of Franklin and New Brunswick over on Eastern Avenue, so keeping an eye on those. And then also disseminating any community events that I become aware of that we could share with the community, as well as sharing with the Board of Health Advisory Council, so they could share further with the community. So looking forward, one of the things that, thanks to Councilman Karazi, we were able to become a part of the network of the New Jersey Local Board of Health Association, so we're now members of that. So going forward in the future, we're going to invite them to come and be guest speakers. That will be a great opportunity for us to learn about what other boards of health advisory councils are doing, and being able to give us some ideas on how to be creative and looking at certain issues that we may not have on our radar right now. In addition, looking at bringing in, like I said, education's been a main focus of mine, so bringing in to educate about other things. One of our members has reached out to the food bank, so probably August or September, we'll be having the food bank come to speak to us about food deserts and issues like that, trying to identify and address the social determinants of health that can impact our community. Other things, I've also gotten the phone number for the housing person, so looking at that to see if that's an issue in Franklin and what we can do to address those issues. And then also, I attended an excellent presentation on human trafficking. I think that's something that we don't clearly recognize, that it's in our own community. So trying to make our board aware of that, and then trying to make the community aware that this is something to be on the lookout. And then the last thing was also to promote goals and mission of the Franklin Stigma-Free Council. I'm also a member of that. I am heading up the ageism subcommittee on that. And so what we're looking at right now is to develop an intergenerational art project where seniors from the senior centers and maybe the youth center can partner on things. Another goal, and this is a particular goal of mine, would be to also consider looking at Franklin becoming an AARP age-friendly community. And I just put in the white area there that this is something that has actually been on Governor Murphy's agenda, that he's trying to promote that throughout the state. So things to consider for the council. We do all this with no resources. So as a council, we don't have a budget. So when the secretary or the acting secretary has to do minutes and print them out for the group to review, they're doing that on their own printer with their own ink. So that's one thing. So that's something to consider. Other is to need better coordination between not only the Somerset County Board of Health, because, as you know, the Board of Health does a great job, but even the needs that were addressed in that needs assessment go beyond the Board of Health. And so looking at things like mental health issues and trying to reach out to other Somerset County agencies to address the needs of Franklin. And then also to identify ways to reach the diverse population in Franklin, the shut-ins, English as second language, not just those who participate in surveys or focus groups, how to reach those people to identify what their particular needs are as well. And then this is something that is a particular concern of mine. And this is something where, and I know, and I'm speaking now more for, this is not something that I've cleared. In fact, I do want to take a step back and say that these slides, I wasn't even aware that I had to give these to council. In fact, this is new. I didn't even find out till just today that slides were an option. So I apologize if the council does not have this. And so my board doesn't, my council doesn't even have these slides, besides just the council here. My Board of Health Advisory Council doesn't have these slides. These slides were just created today. So one thing I do want to recommend or do stress, just food for thought, is that we have a lot of cannabis establishments approved in Franklin and probably more on the way. And more the data is showing that there is harm associated with use of cannabis. We're seeing that there are increases in the rates of psychosis. We're seeing that there are increases in the rate of cannabis use disorder. And when we look at adolescents, we see that they have a higher risk of that. And so I just have some information here, and so maybe even this is something that can be done in coordination with the police department or just a task force to, you know, we're approving these things, but what is going to be the impact on the community? And that is my very great concern, because I like I said, I'm on that international organization as well, and I've seen the things that have happened in other towns where this has happened. Increased motor vehicle accidents, increased, like I said, cannabis use disorder, psychosis, and then another thing that's happening too, increase in cardiovascular effects. We know that there have been a number of patients who develop heart attacks, ischemic events, and stroke, and those things have all been increased by the use of cannabis. And I won't go through all this, but that was data that I showed you there from SAMHSA, the Substance Abuse and Mental Health Services Administration. But I do want to, for the sake of time, I do want to point out, now that edibles are coming, this is something that is extremely concerning, because every area that has approved cannabis edibles has seen an increase in pediatric toxicity. This was an article that I actually published in 2022, before they were approved for use here. And then this is data from the National Poison Data Center, and it's shown that progressively the number of cases of pediatric admissions due to cannabis edibles has been increasing every year as more and more states come on board with both recreational and medicinal marijuana. So this is something that I think that we really need to, I don't know how, and I present that to the council for their guidance on how that we should be, how we can look at this and to make sure that our town is safe, to make sure that if people do use this, that they're educated, that they know to lock this stuff up. And it's not only, and the problem goes beyond locking up, because, you know, if they bake things with it, know to keep those things out of reach. So there's so much, I think, that we need to do as a town, especially since we have so many establishments in the area. And I think, oh, hold on, every time. Oh, I know we're running short on time. The same problem again. So I just, 2 more slides, Mike? Sure. Okay. I don't, okay, okay. I have a touchscreen at home, so.
Yeah.
Okay, thank you. Okay, so I just did want to point this out. So this is data looking at toxic effects and where the critical breakpoint level. And so if you look at the weight of an average or 5 or 6 year old, okay. So this is data that looks at toxic effects. If you look at the average weight based on the World Health Organization of an average 5 or 6 year old, you can see based on the number of kilograms, all it would take is 3 gummies, because the gummies traditionally are 10 milligrams. 3 gummies to produce a severe adverse effect in a little one. And who would eat 3 gummies? I mean, you know, so if they ate a whole package, the effects would be even more severe. Okay, and this is just what I was saying. This is what the American Heart Association came out talking about, the harmful effects on increased risks of stroke and all. But see, the problem is, I don't think the public knows this, and I think it's important to get that word out. And then this is something that actually this was from a little while ago, New Jersey Poison Control Centers are seeing an increase of children being sick from marijuana edibles. So this is happening in New Jersey. So as I mentioned, I'm privy to the data in Colorado, but we're actually seeing this happen in New Jersey already. So with that, I want to thank you for your attention and consideration.
Thank you. You've really done wonders with the Advisory Board of Health.
Thank you.
Yes, I
Leaps and
second
bounds.
that, Mayor.
Leaps and bounds forward.
Thank you. Does anyone have
Continuing,
any questions? I'm sorry. I didn't ask.
Hi, are we able to get a copy of this that
Sure, I'll
sent
send
over?
you that.
Okay,
Yes,
thank you.
I'll send it to Anne Marie. Okay, thank you. I apologize that you don't have it in advance. Okay, thank you.
okay, we need to have a public session on the Board of Health. So do we have a motion to open for Board of Health public session?
So moved. Second.
Moved in second. All in favor, say aye.
Aye.
Opposed, say nay. Motion is carried. We are open for public discussion on Board of Health matters only.
Seeing no one coming forward, Mayor, a motion to close the public portion of the Health Board meeting.
Second.
Moved in seconded. All in favor, say aye.
Aye.
Opposed, say nay. Motion is carried. Do we have any other business? Any other council members have anything? Okay, I'll take a motion for adjournment.
Second.
Moved in seconded. All in favor of adjourning the Board of Health meeting, say aye.
Aye. Aye.
Opposed, say nay. We are adjourned for the Board of Health. And, okay, so we will start in 5 minutes. That is